Yeah, trauma concept is interesting. It is, we sort of learn over many years that traumatic injury to affect this outcome, I mean survival, especially in a critical injured patient, is determined by how soon we can apply resources. Resources means physicians, nurses, respiratory therapy, CAT scan, angiography, everything need to be done in the very front end. So you can imagine, just like nowadays we have heart attack centers, we have brain attack centers. Well, in some way they're very similar, except trauma started way over 25, 30 years ago. We realized, in order to save someone from hemorrhaging to death or severe brain injury, spinal cord injury, it is important to identify the injuries and start to effect therapy as soon as we can, very get-go. So trauma centers are developed so that hospitals are organized. You can have immediate response to the emergency room with a whole team of physician, nurses, ancillary services to provide the best outcome. And that's what the trauma centers differ from regular emergency room. Now, regular emergency room can do a very good job in general, but they don't always have the appropriate resource immediately to respond to some of the most critical injured patients. And the challenge is, when someone's injured out in the field, they may look okay for a period of time, 45 minutes to an hour, and then suddenly their blood loss or whatever injury now have become severe enough, they will just sort of fall off the cliff. The key is to identify the injuries to stop the bleeding, to affect their outcome before they sort of crumble off the cliff.